Hi, welcome to my channel. Hi, welcome to my channel. Thank you for joining me. This is Dr. Erica Pharmacist. I'm just going to briefly talk about this month being the month of cardiovascular health, February. Um, I just posted a video about some supplements that I wanted to share out there. CoQ10, coenzyme Q10 is also called, and also omega fish oil 3, 6, and 9. And then there's krill oil. These are heart protection items that you can utilize in addition to your prescription medications after approval from your physician. Your pharmacist can also help pinpoint these items for you at the local pharmacy or local pharmacy grocery. So do please take note of these items if you're interested in better heart protection. I also talked about dental health. Oral hygiene will also protect the lining of the heart because we have major vessels in our gum lining. Anything that gets into our blood system through our gum lining eventually gets into our heart, um, bacterial, viral as well. Then I also recommended exercise. I recommended bone strengthening as well as cardiovascular or aerobic exercises. Bone strengthening helps increase the bone mineral density, decreasing risk of fragility, fracture as well, allowing the bone to be stronger, producing healthier red blood cells. And again, those red blood cells, they go to the heart. I also want to make mention of sodium intake. Sodium intake 1.2 to 1.5 grams of sodium per day. Less than that or no sodium if you have kidney disease or if you have heart disease or you're prone to pitting edema or lower extremity fluid retention. Also, consult your physician if you have any questions about your particular ability to take in any amount of sodium, also water. We know that sodium and water coexist together. Water follows sodium, salt, sodium products, sodium salts that may be in your medication are also considered when prescribed. Also, pharmacists, we do a medical review about your prescription medications. If there is sodium content in your prescriptions, we will let you know based upon your full medication regimen. So, I came on here to speak about cardiovascular health February month. Um, I also want to just um, be an encouragement to those who are trying to get their health in right perspective, those who are newly trying to understand their health, their medication, trying to better understand themselves because of maybe it could be age, it could be um, learning a family history, disease state. It could be anything that inspires you to want to learn more about your state of health. And I would suggest starting again with your family history, working your way to learning more about research, prescription medications. Are you able to afford your prescriptions? Are you able to exercise? Are you able to diet properly? What is your income, allowing you to do? TrumpRx is a new website of prescription medications of about to date 40 to 45 prescription medications available for discounted pricing through Trump's administration collaboration with prescription pharmaceutical manufacturers. Because he has talk with or come up with a contract with these manufacturers, they are allowing customers who do not currently have prescription insurance or government insurance to pay cash at a discount price for the listed available medications on their website. This has been always going on, from my experience, not through TrumpRx, but through other venues who make contracts with manufacturers for discounted pricing. There are also manufacturer websites directly that allow patients and customers, consumers, to print off coupons, allowing them to receive their medication consecutively or for first go round for a first time consumer of a prescription medication to receive a discount. My thing is, there are some cons to this because these pricings only apply to first time users or second time users. Fifth go round, sixth go round may not get an opportunity to use these coupons anymore. That's a con. Now we have a problem. Now we have an issue that requires a revaluation of the patient's medication regimen. Whereas before it was the perfect regimen, it was the perfect solution for the patient's problem, diagnosis or prognosis. Now, as healthcare providers, we have to come up with another plan if these coupons, according to the Trump administration or the manufacturer's contract with Trump administration, decides they don't want to no longer cover the higher percentage of cost. So that's a con. Pharmacists usually ask the patient to speak with the physician to see if there are coupons or free handouts at the office, or we tell them to contact the manufacturer themselves to see if there's a coupon available. Well, Trump RX is nothing new to myself. I've been a pharmacist for this is my 13th year in October 2026. I have seen coupons, Good RX, for example. I've seen um, all sorts of PBMs, prescription um, prescription management programs receive a large portion of profit from the from the patient. You know, patients each month, like a post I just posted, a news broadcast saying a pharmacist on the news broadcast, I'll say it again, I reiterate it again. Once these coupons, after the first or second go round, have been used, they're no longer available. And then the second catastrophic event could be that the patient doesn't have a lot of money and they still have to choose between medication, grocery, health, seeing the doctor, um, going to, going to work, having transportation, proper transportation, um, for travel to work, travel to here, having to choose between daycare services, having to choose between medication in general, So that's, those are things that this Trump RX is not considering. We need medication, a more holistic medication and healthcare system in this country. Our Trump RX is only a temporary fix because, again, it only allows for the maybe up to the use of a prescription discount, but what about the hundreds of thousands of other disease states that require medications that aren't being covered or have high copays, out of pocket, thousands of dollars out of pocket no one can afford? We need in this system, and we need to vote for a candidate who is willing to cover for the general populations as far as healthcare. Um, Free healthcare, for example, is a solution to this issue that we're dealing with. Um, Glad to see the TrumpRx, glad to see the website, glad to see um, proactivity to some degree. However, free healthcare is what we need. Free healthcare for all. Um, Premiums need to be reduced. Um, Monthly premiums. There are people that are still dealing January 1st, 2026, who are dealing with the change in the premiums. We need to do away with premiums. Um, we need to do away with discounts and seek a service for all, a service that covers everybody. So that's my take on healthcare. That's my take on prescription coverage. And again, if you don't qualify for Trump RX, go to your manufacturer's website, go to your pharmacist, change pharmacies if there's a medication that is cheaper at another pharmacy. If you find you have a prescription that costs a little bit cheaper at another pharmacy, don't hesitate, to change pharmacies, um, to build a relationship with a new pharmacy that will help you to get a cheaper, a more less expensive price. For example, I know there's a list with Walmart, Publix. They have a list of medications and antibiotics that are free or $5 or $3. There's a list at Walmart that's like $5. Um, just talk with the pharmacist, talk with the staff, and ask them. There are free medications. There are cheaper medications at cheaper place at more economical places. Is what I'm trying to say. Don't be afraid to venture out, to change, to explore new possibilities. That's my suggestion in place of the Trump RX at this point. But do check out the website, and he's covering for medications. He's giving discounts on medications like IV treatment, IVF treatment. Who gets IVF treatment on a daily basis? He's giving discounts on, I want to say GLP-1, weight loss, cosmetic. All these things are not for the general public. They're not for the general public, but I'm thankful for this list of medications he's putting out there, but I'm not thankful that it's not covering um for a more holistic um frame of ideology. So what I'm trying to get to, a more holistic um alternative. So unfortunately, things, we have to wait for things to get better. Voting, getting out there to vote, getting out there to do the right thing, getting out there to petition, to support however we can, um, for this administration. And thank you for being a part of my YouTube channel. Sub, like, and share with others. I'm Dr. Erica, pharmacist. I want to leave an encouraging word Luke 12, chapter 12, verse 7 says, God knows the hairs already established on our head. And because he does care for us, even more the even more than the sparrow, that is gives us confidence, not insecurity about who we are, how valuable we are in life, and our purpose, how valuable our purpose is as human beings. So I'll leave that with you, and I hope to see you on my future videos. This is Dr. Erica signing off. Take care. Good night. Bye bye.